Infectious bursal disease, commonly known as IBD or Gumboro disease, is a highly contagious viral disease of young chickens that mainly affects the immune system. The virus primarily damages the bursa of Fabricius, leading to severe immunosuppression. In infected birds, the bursa becomes swollen, inflamed, and may show hemorrhages and necrosis. This damage usually appears early in the disease and severely weakens the bird's ability to fight other infections. Hemorrhages are commonly observed in the thigh and breast muscles. These bleeding lesions are a characteristic sign of IBD and indicate severe viral involvement and tissue damage. Mortality in IBD outbreaks can range from 50 to 60%, depending on the virulence of the virus, flock immunity, and management conditions. Even birds that survive often suffer from long-term immune suppression. There is no specific antiviral treatment for IBD virus. Management mainly focuses on supportive therapy. Antiviral supportive powders, antipyretics to control fever, pH stabilizers for gut health, and antibiotics are used to prevent secondary bacterial infections.